come here. So are you NHIF accredited?
Charge only 40 minutes.
Well, if you're
Not yet.
not yet,
I believe.
not yet NHIF accredited. Give us that.
You have the doctor right behind you.
I used to have tinnitus,
Yes.
but it disappeared.
It disappeared. That's
Yes.
good.
Uh-huh.
So this is our room.
Uh-huh.
Oh, in fact, as your outpatient,
Uh-huh.
your parts are both meters there.
Uh-huh.
Yeah.
Great.
So, as a clinician,
Uh-huh.
so as the word says there, ENT and audiology consultation. So I will receive the patients here, do a clinical examination, diagnose, and then treat or give out the interventions. The intervention which will include either medical, surgical, or rehabilitation.
So how do you measure? How do I know my ear is
You are
okay?
occupying. What you do, you go into another room.
Yeah,
maybe
audiology.
because now this is the consultation. You come with your complaints, I see you, I diagnose, and then I know where to refer you to.
The problem.
Yeah, the problem.
Great. So tell me, Starsky.
These Stake is one of the outlets of hearing aids. In
Okay.
fact, they are represented there.
Uh-huh.
So the outlets, so we can advise that because we have got different states or different
But
styles.
are you only promoting this one
No,
hearing
no, no,
aid
no,
or
no.
others?
No, no, no.
Okay.
It's only that we have put the posters here.
Great.
Yeah.
Great. Great.
So for a patient, maybe you'd like to explain something about the ear. Here is a pictorial presentation. Yeah. And it's good I heard you mentioned about otitis media with diffusion.
Yes.
That is where kids you see, you think they have got tantrums.
Oh, the glue.
Yeah, the glue here.
The blue.
Yeah.
You've never heard of it?
No.
In the
Yeah.
UK, they're doing operations for the blue
We
ear.
take vitals here.
Vitals, yeah.
Before they see the doctor.
Yeah,
Before
yeah.
they see the doctor.
So basically,
Basically-
when one comes here, do they get just diagnostics? Then you come here.
Well,
And you get the support.
yeah, because actually after from that place,
Do you
yeah,
have surgical interventions?
surgical interventions, because we are not at that level, we have a referral system.
So where do you refer them to?
Kenyatta National Hospital.
So they have a department that deals with that.
Yeah, we have got an ENT department.
Fine.
And in fact,
There's something making noise in my ear.
yeah, there could be a piece of hair, there could be wax. So,
This gentleman here.
Hi. Very good. Uh-huh. Uh-huh.
Here we do, once the assessment is done on that side, the doctor refers the patient to this side. We start with taking we call it PTA, pure tone audiometry, to assess the hearingness of the patient. Once it is done, he comes here, he goes there. This is the ear mood production unit. Yeah. We do the ear.
we do an impression from that time.
We do an impression from this side. Those are the materials. From
The
here.
gentleman here, the
goes
one
there.
details of the impression.
Once that is done, now the patient comes back to me.
So tell me, the services that you're offering here, at the moment you're not accredited to NHIF, which I hope you would be, but because it's an outpatient, right? How are the prices compared to other facilities like yours?
Okay, our hearing aids, we normally get some of these hearing aids from donors and well wishers from Germany.
Right,
Netherlands.
right. So then you give them at a subsidized rate or free.
It's not even on subsidy price. We give free
Okay.
to our schools for the deaf.
Right.
I think we have one of the principals here who are in our schools.
Fantastic.
Yeah, like
But it's
the
actually
other
not
day I was in Machakos. We did about 60 children.
Right.
Before that we were in Kitui.
So what am I getting? There's permanent deafness, and then there's partial deafness, and then there's those that if you do a certain treatment, they will actually start hearing, right? So what are the percentages that you find of people who are partially deaf and then with a device they're able to hear?
They are there, they are even in our schools.
Yeah.
Yeah. But immediately you identify a child that can benefit from a hearing aid. We like taking them to a regular school.
Right.
Because in a regular school,
Yeah.
you can get more, you can acquire
In
more.
advance, yes,
Yeah,
yes,
so that
yes,
stuff. So a lot of our schools, let's say about 70% are totally deaf.
70% of you do
Now when you are totally deaf, hearing aid cannot
not help you. Right. That's when sign language comes in, and then I've actually had some parents saying that most of the teachers in the schools, the schools that are not predominantly for deaf children, learn the sign language from the children. So I think we need to really make sure that they learn it and know it, so that they can interact better with the children, rather than learning it from the children.
It is true. They also, our teachers, when they are teaching these children, they use what they call total communication. They speak, they sign, and when they speak, these children catch something with the lips. They are very good at repeating. So at the end of the day, if a child needs to be educated from the teachers, you can't go home without anything.
Okay.
Yeah, without anything.
Fantastic.
Yeah.
Thank you for the good work you're doing.
But for the other
Also, by
side,
the way, there's also something that is not saying, but they do. Most of these hospitals can actually come to you.
Okay.
yeah. This is another very unique area.
Calibration.
We do calibration of audiometers. Audiometers are the equipment that do the assessment of the ears. There's a government requirement. You must be assessed with a calibrated audiometer. And it is done annually.
So let me ask you. No. I mean, that annual. We're trying to move it. It can be, this annual maybe 2-3 years, but annually it's too much for the PWDs. What I want to know is, when they do the medical assessment, this is a necessity. So if we do a camp, then everybody will have to be assessed by this for you to confirm.
By that audiometer there. That is the equipment that we calibrate.
Okay.
And the equipment, it is found in our hospitals and our private clinics. So if you do an assessment with uncalibrated audiometer, you give a long result. A long result gives a long prescription to the hearing aid or to other
Do
things.
you have assessment centers in almost all the areas where
We used
in
to have
almost
them.
all the schools?
We used to have
Yeah,
assessments all over the
assessment
country,
centers,
but of late, very few are
Because if the
functioning.
equipment are not functionning, then you can't do it.
If not
Yeah, but then the one thing
functioning,
is, have you tried Bagaba? The
Me, I
hearing
want to measure.
clinic?
my question is, if the assessment centers are not functioning, then do you want to tell us that all the children who have issues,
We have a lot of problems. Yes.
because
We have a lot of problems in the even here in Nairobi, apart from those who can afford to go to a private hospital, the others go to Matare, there are children there who have never been assessed. Go to Kibera, there are so many children who have not been assessed because they cannot afford the assessment in the private hospitals. But when the assessment centers were functional in the counties
yes,
and in the schools, because like in Meru, the assessment center was hosted in a school for the deaf.
for the deaf, yeah.
And everybody was going there to be assessed. And at the end of the day, we could place children in schools. We could tell them what to do. If this needs treatment, go be treated and go to a regular school. Those things are not there.
Rhoda, what I'm suggesting is, only the wearer of the shoe knows where it pinches.
Yes.
So if we could, we'll have a secondary meeting to discuss what are the ways to streamline and understand where is government failing in its public institutions, and where can they improve. Right, so I think we would ask the necessary questions so that we can make sure that proper assessment is first available near to the people. I think if we want to achieve the Social Hospital Insurance Fund, we have to do that. So I will meet with you again, or I'll send my team of lawyers to sit with you, so we can structure the right questions to ask the Ministry of Health, right, in as far as the centers that they have that are actually functioning. And I think we need to also have an audit of them, you know, because sometimes they could tell us that they're functioning, but they're not. But if somebody was to see this today on TV, right, or on our feed, and they have a child that they believe has a hearing problem, and they come here, right? Since you're not already accredited by NHIF and NHIF doesn't do outpatient, what would they pay if they came just for an assessment today, for instance?
1,500. Consultation.
Yeah, that's
Consultation is 1,500. Then you'll be told the problem. If the problem is identified and that child needs a hearing aid, that is now a different cost.
So now, if they need a hearing aid, and you have some donors that provide hearing aids, are you always having the hearing aids from the donors, or not always?
Not always.
All right.
We buy, and then we sell. But I want to assure you, we buy the best, and we are cheap. You heard Mheshimiwa Raim
100,000.
saying, even there are 200, 240 in the private hospitals and in private.
Yeah, so
but we do it at 80 from both.
80
60,
from both.
40.
40.
Yeah.
Okay, so now the thing is, first we need to figure out how we're going to make sure that the assessment and the hearing aid are covered by SHIF, because majority of the Kenyans that are out there cannot afford that. It's too high.
Yes.
But the next thing is the 1,500, right? So if you're out there and you've got a child or a family member who's deaf, then visit, we'll put the details of the clinic where it is.
Yes.
Visit here, it's 1,500. You can have a consultation that takes you to the first stage of knowing what you're dealing with and what are the interventions that you can have, so that you can better the life of your child or your own self.
True.
Right, so 1,500 shillings you can get fully assessed.
Yes.
Okay.
But
And-
to me,
and-
Mheshimiwa, what is very key to me, and what I've gotten from the CEO, if the assessment centers in our rural areas,
Rahim is already getting
if the assessment centers in our rural areas are not functioning, so that is an issue that we must pick up as a matter
exactly.
of urgency
And-
to the
and
Ministry
also-
of Education, because
Yeah,
Yes.
the assessment centers
Yes,
don't
they are
deal with
not
the Ministry of
functioning.
Health
it's
at
the Ministry
all.
of
It
Education.
is the Ministry of Education
Yes.
and the TSC,
The
and that
TSC,
is
yes.
where the problem is.
So
Because
yeah.
the teachers who have been taught on taking assessment and
Assessment.
taking audiograms and all that, they are teachers who are employed by the
the
TSC.
Ministry.
Okay.
Now, the people they are dealing with in schools and where the assessment centers are situated are in schools, Ministry of Education. So the tug of war is who should pay that person at the assessment center. That is the only problem.
Yeah, so the thing is,
But they were also being funded, the assessment centers. I know because I was in a school and the funds
There was
were
an
coming
assessment center.
through us to the assessment center. Then they also opened their own
I think
account.
we have three
They are
problems.
funded by Ministry of Education.
Rhoda, we have three problems. We have one, making sure that the equipment that is being used is functioning
Yes.
and giving the correct report.
Yes.
Two, that the technician who's conducting the test is well trained
Yes.
to do the test.
True.
And then three, who is responsible for paying the technician, all right?
Yes.
And conducting the test. So between the Ministry of Education and the Ministry of Health, I think we need to have a multi-sectorial approach because it's got both components. So I will engage both CSs and or both ministries and see what is the best way forward.
Yes.
Right. But I want to thank you so much for launching this clinic today and offering that service. Right. At the end of the day, we don't compete with each other. We complement
each other.
Thank you and God bless
Thank
you all.
you. Thank you so much.
All right.
Thank you.